This is the top 5 mistakes in trauma and how to avoid them. 1. Failure to identify an obstructed airway. The patient is breathing, but is the airway truly open? Opening the mouth and seeing chest movement is not always enough. If there's snoring, labored breathing, or the patient is unconscious, you must act and never manage the airway without protecting the cervical spine. One wrong move could leave the patient alive, but 2. Poor control of external bleeding. A massive external hemorrhage can kill in under 3 minutes. If you prioritize starting an IV over stopping the bleeding, you're already late. The first priority is what you see. Direct pressure, hemostatic dressing, or tourniquet if needed. The body cannot oxygenate if there's no blood left. 3. Failure to protect the cervical spine. Did you open the airway by lifting the chin without spinal control? Did you move the patient without thinking of an unstable fracture? Then you made a common and serious mistake. Spinal control is not optional. It is the first step of the ABCDE. Always assume injury until proven otherwise. 4. Ignoring signs of attention. Is the patient breathing? Yes, but is ventilation effective? That's the real question. A rigid, asymmetric chest or absent breath sounds on one side may hide attention. If you miss it, the lung collapses and then the heart. Palpate, listen, evaluate, act. 5. Failing to prioritize using the updated ABCD. ABCD is not a checklist. It's adaptive clinical logic. If there's massive bleeding, it comes first. If the patient is hypoglycemic, it might look like a head injury. It's not about repeating letters. It's about understanding priorities and thinking beyond the routine. In those critical minutes, you are not just a technician. You are the final barrier between life and death. You're not there to repeat steps. You're there to reason, to act, to decide, because smart assessment saves lives, and one mistake might not be reversible. If this video made you think, then it already served its purpose. Subscribe to keep learning and growing as an emergency professional. Watch our full video on the updated ABCDE. It will change how you act. And tell us, what critical error have you seen or lived?